I'm Megan and I run LocutusHealth. Way back in 2012, I was working in revenue cycle underpayments at a hospital SaaS vendor. My desktop was a nightmare of EHRs and payer manuals. I had reimbursement contracts all over my desk. And I would spend a good chunk of my days talking with individual hospital leaders about the best ways to use the software that they'd invested in. At the time, I didn't know the answer, but I did know that there had to be a better way to communicate the potential value that they could be accessing through our tools. What I eventually realized is that the answer was content marketing, the kind that was really built for the complexities of enterprise healthcare. That's why today I help marketing leaders at healthcare tech vendors activate stagnant or stale content marketing. I'm focused just on early stage content programs and initiatives. So things like product launches, brand refreshes, new event strategies, and content programs that are just getting off the ground. Essentially, before you commit to an agency or take on the risks of an FTE, I'm who you turn to. We work together to put your team on the path to results that are really aligned with business intent and dedicated to proving that marketing isn't just a place to cut costs when times get hard. It's a provable revenue center. I've got deep experience in enterprise healthcare tech, and I'm connected with an extensive network of specialized professionals. But I picked up a cross-industry perspective from business school. And all of that together is why I'm dedicated to growing programs that are focused on ROI and really making sure that my work augments confidence in marketing teams of any experience level. Many of my clients have been with me 5, 7 years or more, during which time we've doubled customer email open rates, built case studies that help close the first deal after long sales droughts, launched highly effective sales content library, and just overall taken the weight of the complexities of enterprise healthcare content marketing off their shoulders. Back when I was working on the vendor side, I regularly sat in rooms and on calls on site with hospital CFOs, CMOs, VPs. I was regularly working with billing managers and analysts, and this started during the sales process and ran through implementation to software going live. I learned how they thought, how they made decisions, and most importantly, how those decisions impacted their patients and care communities. After a layoff, I got the opportunity to connect the dots between vendor content and healthcare leadership needs. This was through ghostwriting, writing for trade pubs, and thought leadership of healthcare tech CEOs and brands. But I quickly realized something. I saw that my clients were underutilizing my work, making simple and avoidable mistakes in content distribution, failing to connect the dots between healthcare decision-maker needs and the value their solutions offered. Overall, they were just missing opportunities to create a cohesive and intentional content experience. They were missing opportunities to build content marketing programs that punched above their weight class. In my 10 years working with clients ranging from hospital finance software to clinical decision support, health system inventory management, and beyond, I've identified 6 pillars in content marketing. Pillars that vendors like you should establish to ensure your content is an extension of your value proposition. These pillars make up my value-based content marketing system, and they're what I use to evaluate programs like yours, identify gaps, build scorecards, refine your path to program maturity, and ensure that you're getting the most out of anything that we create together. I do this through content strategy, content creation, and industry playbooks. But the most important question that I need to answer is Locutus Health. You might have guessed it. Yes, it is a Star Trek reference and a play on the idea of combining humans and tech in enterprise healthcare. I'm looking forward to getting to know you and working together to help healthcare stakeholders tap into the value and insights that you have to offer as a tech vendor.